I want to make sure about something. This talks about mandatory federal spending on health care. So that doesn't talk about overall national spending on health care. It's just the federal government programs, principally Medicare and Medicaid. S-CHIP, of course, as well. But so this is just those programs that are under the purview of the federal government. And you show a decrease in spending long-term going into 2035 as a result of the historic health reform legislation that we passed this year. Now, a couple of points on that. You show a drop in spending overall in 2035, even though we will have by then added about 30-some-odd million new Americans into health insurance programs. So at the same time that we're adding new people into these government-sponsored health insurance programs, we're actually reducing the cost of health care overall.
So yeah, if all the provisions of the law are implemented as enacted, then you are both increasing the number of Americans with health insurance and reducing by the late 2020s federal spending on health insurance under our projections.
So what sometimes gets lost in a chart and with lines and gaps in the different lines that don't look that significant is that in between the 2009 projection, the blue line, and the lowest of the lines, the projection with the historic health care plan enacted, is that there are some 30-some-odd million Americans squeezed in between those lines that wouldn't otherwise have had health insurance without the health care reform.
Yes, I mean, we haven't done the projections of the number of people out to the second decade, but you're certainly, I mean, your point is right. The legislation, as you know, reduces spending in Medicare and uses that money and other money to pay for subsidies for health insurance for tens of millions of additional Americans.
Okay. And my understanding is private sector health care costs have been rising faster than the health care costs for Medicare for quite some time. My number, I have something that shows that over the last 10 years of a period covered 97 to 2008, over 10 years, private health insurance spending grew by 6.9%. Medicare spending grew by 4.5%. So once again, this chart only shows the spending at the federal level with federal programs for health care. It doesn't show the overall cost of health care for the nation, and certainly doesn't factor in private health care spending, which has been rising at a faster rate than Medicare spending has been rising.
So there is a brief discussion in the report about overall national health expenditures, but we explain there that we don't really model some of the pieces as closely as we model the federal pieces for obvious reasons. There is also a table that compares cost growth in Medicare, Medicaid, and the rest of the healthcare system. And the relationship in the growth rates across those different aspects of the parts of the health system differs over time. So there are periods where Medicare spending has grown faster than in the private sector. There are periods where Medicare spending has grown more slowly than in the private sector. Depends what period one looks at, and of course what both the underlying dynamics of the system and also the policies that you and your colleagues have been enacting.
And that's a great segue to my final area of questioning, in that if you could put up, I'm not sure if it's chart 8, I see a number 8 under your three final points, yeah. Chart that had your 3 final points. You mentioned in your third and final point that in your judgment, the health care legislation enacted this year made a dent in the problem but did not substantially diminish that challenge. And once again, that goes to the point that we made a dent, but we're not taking into account the fact that costs for health care aren't driven by what we pay in Medicare and Medicaid. Essentially, Medicare and Medicaid don't determine the cost of health care. What they determine is the level of reimbursement for providers who provide health care to Americans who qualify for Medicare and Medicaid. And so therefore, we can cut Medicare or Medicaid all we want. That doesn't necessarily result in health care costs dropping the same amount, because the private sector may not follow suit. And we may find that a lot of these providers that are right now accepting Medicare and Medicaid may say, forget it, we're no longer going to take Medicare and Medicaid as reimbursement, and we're going to go somewhere else, private insurance, cash, to get payment. So we can make a dent in health care costs, but we can't resolve the problem simply by cutting Medicare or Medicaid in and of themselves.
Well, it depends what the problem is that you're referring to. Of course, our projections of the federal budget, what matters is federal spending. Obviously, one might well care about other sorts of other aspects of the society and economy as well. You're right that changes in Medicare payment rates don't translate necessarily into equivalent economy-wide changes in health costs. At the same time, of course, about half of health care in this country is paid for now through the public sector, and about half through the private sector. And there's a chart in our outlook that demonstrates that. So the way in which the public programs work is a very important factor behind the way that the healthcare system operates.
Yeah, and we'll need to figure out a way to get the private sector involved in this effort to corral healthcare costs if we're ever going to have a real success for Medicare and Medicaid, but just generally for Americans in terms of how much they'll pay for healthcare. One last point, and this is more for those of us, Mr. Chairman, on the commission. I think the first point in your final 3 points, Mr. Elmendorf, I think goes to this whole issue that I've tried to point out, that we have deficits, but to me the biggest deficit we have is the jobs deficit. And I think to the point that Mr. Elmendorf raises here, that while the unemployment rate is high and many factories and offices are underused, there's nothing that says it's wrong to try to stimulate the economy to get it going again, so that later on, when output and employment are closer to their potential, then you have to really tighten the belts and get fiscally, I won't say fiscally responsible. Hopefully we've been fiscally responsible generally, but that's when you can go ahead and start to make those really tough decisions on how you tighten the budget itself. But I would hope that what we do is recognize that more people are working. The more of those millions of Americans that Mr. Elmendorf pointed out are working, that means they're paying taxes instead of collecting government services and benefits through unemployment and elsewhere as a result of not being able to work. And my last and final point is to your second of your 3 points, the long-run fiscal imbalance. Some of the members here would like us to use the CBO's alternative fiscal scenario as our baseline. While I agree that we use Mr. Elmendorf and his shop to determine the numbers, I would be very careful about going anywhere near the alternative scenario, because for our purposes, if we are truly serious about having everything on the table, we will have done, I think, made a breathtaking decision to take many things off the table by saying we are using the alternative fiscal scenario as our baseline, because we are thereby assuming in absolute terms, without any discussion, that we will extend tax cuts that went principally to Americans who are the most wealthy in this country. And we are assuming that we will continue tax cuts that help drive us into these massive deficits that we have today. So to make those assumptions by incorporating this alternative fiscal scenario as our baseline, I believe is a breach of our commitment to keep everything on the table until we make a decision on where we go.
So I'm sorry, Congressman. Of course, what the Commission does is up to you, not my business. But I want to clarify something I didn't talk about before so carefully, or carefully enough, apparently. In the extension of the tax cuts underlying our alternative fiscal scenario, we use the pieces identified in the statutory PAYGO law. That actually is the tax extending the 2001-2003 rate cuts for the lower and middle income people, not extending them for the higher income people. If they were also extended, that would make the alternative fiscal scenario somewhat worse. Not dramatically different. Most of the money in the 01 and 03 tax cut extension is for the people with income below $200,000 or $250,000.
And Doug, I agree with what you just said to a point, because there were some provisions in the statutory PAYGO that went beyond helping those who are lower and middle income that we need to explore. But for the most part, I think you're right. But even if it were just for the modest and middle income that we would be taking the conversation off the table, I think that would still violate our obligations in this commission to keep everything on the table, because everyone should be part of the gain, and that means everyone should partake in the pain as well. Thank you, Mr. Chairman.